Iron is one of the most widespread chemical elements in nature, so much so that it constitutes 5% of the weight of the Earth's crust. Used since ancient times for its hardness and resilience, iron is also an essential mineral for the survival of many life forms, belonging to both the animal and plant kingdoms. Iron plays an important role in many biological processes of the human body, as it is necessary for the production of hemoglobin, protein contained in red blood cells, responsible for transporting oxygen from the lungs to the body tissues, and myoglobin, protein present in skeletal and cardiac muscle tissue, where it has the function of storing oxygen in the muscles to release it when needed. Iron is also involved in the activity of many enzymes and in the synthesis of some hormones, supports the immune system, and promotes growth and normal physical and cognitive development, especially in children and adolescents. In the human body, there are approximately 3 to 4 grams of iron, 65% distributed in hemoglobin, 10% in myoglobin, and the remaining 25% in the liver, spleen, and bone marrow. Since our body is not able to produce this mineral, it must necessarily be obtained through food. The iron present in foods can be present in 2 different forms: heme iron and non-heme iron. The first is of animal origin and is more easily absorbed by our body than non-heme iron, and is found in red meat, chicken, fish, and egg yolk. The second, however, has reduced absorption and is found in foods of plant origin, including green leafy vegetables, dried mushrooms, legumes, dried fruit, and whole grains. But what happens if we don't get enough iron? What are the symptoms of its deficiency? Let's go see them. Fatigue. Asthenia, from the Greek absence of strength, indicates a state of excessive tiredness, weakness, and lack of energy, which inevitably reflects on the daily activities of the affected person, thus limiting the ability to carry out normal tasks and negatively influencing their quality of life. This happens because the body, not having a sufficient quantity of iron available, has difficulty producing enough hemoglobin, causing a decrease in the transport of oxygen in the tissues, and consequently, a feeling of tiredness and lack of energy. In fact, we speak of iron deficiency anemia, as the decrease in hemoglobin is caused by a lack of iron. The heart will also be forced to work harder to compensate for the lack of hemoglobin, and guarantee a sufficient quantity of oxygen to organs and tissues. In the long term, this condition can lead to cardiomegaly, that is a pathological increase in the volume of the heart, or to heart failure, that is when the heart is not able to pump an adequate quantity of blood compared to the actual request of the organism. Headache. In the initial stages of an iron deficiency, frequent headaches and prolonged migraines may occur. According to the results of some studies, iron plays an important role in the synthesis of some neurotransmitters, including dopamine, norepinephrine, and serotonin. So a deficiency of this mineral causes metabolic abnormalities in the brain, which lead to a reduction in activity neuronal. A decrease in levels of serotonin in particular, a key neurotransmitter in the neurobiology of migraine, appears to make a person more likely to develop headaches. Another explanation is that a lack of iron can lead to a reduced flow of oxygen to the brain, causing the onset of a medical condition known as cerebral hypoxia. In an attempt to conserve as much oxygen as is available, the blood vessels in the brain will begin to narrow, consequently increasing intracranial blood pressure and therefore causing headaches. Pallor. Each of us has a different color and skin type than others, as it depends on a combination of some factors: genetic, environmental, and individual. In the case of an iron deficiency, the reduction of blood flow in the superficial capillaries or decrease in the levels of hemoglobin will cause the skin to take on a pale color, thus appearing lighter than normal. This disorder can manifest itself in a localized way, that is, in a particular body area, for example on the face, or in a generalized way, therefore involving the entire body. Pallor can often also affect the mucous membranes, such as the tongue, gums, and the inside of the cheeks, but also the internal organs. In this case, the pallor will not be directly observable, but the effects due to the poor supply of oxygen have repercussions on the entire organism. Dyspnea. Dyspnea, also known as air hunger or shortness of breath, is a medical condition in which breathing appears labored, painful, and forced, thus having the sensation of lack of air or of not being able to get a sufficient amount of it into the lungs. When there are not sufficient levels of iron in the body, the lower concentration of hemoglobin reduces the blood's ability to transport oxygen correctly to the lungs, consequently favoring the onset of breathing difficulty. Sensation of air hunger that tends to worsen during physical activity or in situations in which the body requires a greater supply of oxygen. The heart will thus begin to work more intensely, accelerating the heartbeat and leading to hyperventilation, medical condition characterized by the increase in the frequency of breathing, with a consequent reduction in carbon dioxide levels in the blood, as the quantity eliminated through breathing exceeds that produced by the body. Brittle nails and hair loss. Hair, as well as nails, are mainly made up of keratin, a very resistant fibrous protein consisting of long chains of amino acids, as well as lipids, water, pigments, and minerals. Among these, we find iron, as well as magnesium, zinc, and copper. Some studies suggest that an iron deficiency may be related to alopecia areata, sudden patchy hair loss, or androgenetic alopecia, the most common form of baldness, in which there is a progressive decrease in the quantity and thickness of hair, particularly on the forehead and temples. In case of an iron deficiency, poor hemoglobin production reduces the supply of oxygen to the hair follicles, consequently weakening the hair and contributing to its loss. The nails are also affected, as they will become more fragile, with a greater tendency to break. In some cases, they can lose their normal convexity and become flat, or even take on a concave shape, which resembles that of a spoon. This altered conformation of the nail, which leads to the thinning of the nail plate, is in fact called spoon nail, also known in the medical field as koilonychia. Its pathogenesis is not entirely clear, but it may be related to the reduction of iron in some enzymes present in epithelial cells, or to poor blood flow, resulting in weakening of the underlying nail connective tissue. In conclusion, it is good to remember that an iron deficiency can manifest itself with a series of different signs and symptoms, which vary from person to person. If you experience one or more of the symptoms described in this video, it is advisable to contact a doctor or specialist in order to receive an in-depth diagnosis and possibly personalized care treatment.